Cecil County in the World, this is our monthly session with the Cecil County Health Department. We have trained professionals here, introduced by Health Officer Lauren Levy, and hopefully do this every month. And the public out there will know a lot of stuff about public health and how to keep safe, how to keep their kids safe, how to respond to some of the current crises going on health wise. And our first speaker here today is Tina Bell, Community Health Nurse 2 with the Cecil County Health Department, going to talk about infant safe sleep.
Hi, everyone. I'm talking to you about SIDS, SUID, SUDI, and ASSB. SIDS is sudden infant death syndrome. SUID is sudden unexpected infant death. SUDI is sudden unexplained death in infancy. And ASSB is the new one, accidental suffocation or strangulation in bed. All of these you may hear used interchangeably. So we want to talk a little bit about this. It's not just SIDS anymore. So the national SUID rates ranged from, in 2018, they ranged from 49.5 to 178.3 out of 100,000 live births. And in Maryland, from 2014 to 2018, our range was 92.2 out of 100,000 live births. Let me just get down to it. What is the recommendations from the American Academy of Pediatrics? Are to always place the infant on their back to sleep at every time, nap time, bedtime, every time. Use a firm, flat surface with a mattress only covered by a fitted sheet. Infants should be alone, not with siblings, parents, other adults, or pets. Keep the crib clear. No soft bedding, bumper pads, pillows, blankets, stuffed animals, or other toys. Um, Offering a pacifier after breastfeeding is established. Breastfeed when possible. To prevent overheating, adjust the room temperature. 70 degrees is a comfortable setting for infants. Um, they should not be bundled up inside. They should not wear a hat when inside. They're usually comfortable in the same type of clothing as an adult is, or maybe one light layer extra. Using a sleep sack instead of blankets is preferred, or to dress the baby in a sleeper. Um, to not smoke or vape or when pregnant or around the baby, and to prevent others from vaping or smoking around your baby. Do not use alcohol or drugs when pregnant or when caring for your baby. Um, Receive prenatal care. Make sure the baby attends their regular checkups with their doctor and receives all of their childhood immunizations as scheduled. Avoiding swaddling once the baby is able to roll over, which is usually around 4 months of age, but swaddling up until that point is okay. And tummy time is encouraged when the child is awake and only with supervision. If the child falls asleep in their car seat, a swing, a bouncy seat, a bobby pillow, any of those things, it's best to move them to a safe sleep area as soon as possible. If it has straps, it's not for sleeping. Um, Reasons for this is because the children, wiggle and move around a little bit. Sometimes their head can fall forward, which cuts off their airway. They can wiggle into a position where they can't get, where their faces are like against the sides, or they can't take a breath in, and it could suffocate them.
Wow,
So you want
that's a lot,
to.
Tina.
It is a lot. It is a lot. So remember the ABCs of safe sleep: alone, on their back, in a crib. That's the majority of what you need to remember. Share your room, not your bed. Nothing in the crib with the babies. Keep them on their back to keep them safe, um, and in their own safe sleep area. I think that pretty much covers it. The reason that the back was established as the safest area is because in the anatomy of the child, when the child is laying on their back, if they happen to spit up accidentally while they're sleeping, gravity helps pull the contents back down into the stomach. If they're on their stomach, laying on their stomach when they're sleeping, and they spit up, it doesn't run out of their mouth, but gravity could pull that down into their lungs because of the position of the trachea and the esophagus, or their airway, and their feeding to where they swallow. So, and also another concern for when they're on their stomach is they're rebreathing, continually rebreathing the same air, so they're not getting enough oxygen. So that's why it was recommended to put the child on their back.
All this stuff makes real good sense. I have a question for you. What is
Sure.
swaddling?
Swaddling, that's when you're wrapping your baby in a blanket, like they do in the hospital when they're first born. And it's a certain way that they're swaddled, that kind of puts their arms inside of the blanket, and it gives them what they feel like gives them boundaries so that they feel safe,
Right.
because that's what they were used to in the womb. But after they start are able to roll over, you shouldn't swaddle them anymore.
Okay. Well, at 4.5 months you can do it, but after that, no swaddling.
Right.
Or 4 months, I guess it was. And
Yeah,
don't
at
share
about
the
four
bed. As
months.
much as you love the children, don't let them sleep with you in the bed because you might roll over on them. Is that the idea, or?
Yes. You could possibly roll over on them, or even they could get they could be pushed up against you. They could fall in between the bed and the mattress, or the mattress and the wall. There's several different reasons why you shouldn't have them in the bed. You shouldn't have them with siblings, because like the other child may roll over up against them or throw an arm against them if the child's bigger, and they may
Right.
not be able to breathe that way. Sometimes pets can cause issues as well if they get up against them or have their or up against their faces accidentally. Um, and even if you have twins or multiples, you shouldn't have them in the same bed. You should have them in their own safe sleep area.
Okay. Good, useful information on infant safe sleep. Thank you, Tina. We hope to see
You're
you again real
welcome.
soon. Next up is Jean Marie Kelly, Director of Policy, Planning and Assessment, Community Engagement, and a whole bunch of other stuff from the Cecil County Health Department. Jean Marie.
Hello. So I'm going to be talking about colorectal cancer and the importance of getting screened.
Colorectal Cancer Awareness Month. That's why.
Oh, very good. Yes, March is Colorectal Cancer Awareness Month. So it's very important to get screened, and we're going to talk a little bit more about what colorectal cancer is, as well as the parameters around getting screened. Okay, so colorectal cancer is the second leading cause of cancer deaths in the U.S.
Thank you.
Oh, sorry, yes.
Okay, now I'm going to talk colorectal cancer screening because it's month. That's the color, correct?
Yes, blue is the color.
Okay, tell us all about it.
Okay, great. Colorectal cancer is the second leading cause of cancer deaths in the U.S. It is a disease in which cells rapidly grow in the colon and the rectum. This can be out of control, which can also create polyps. So a lot of people have heard of polyps in the colon that is associated with cancer. It is often diagnosed in later stages, which is why it's really important to get screened, because the screening can identify the cancer at a much earlier stage. Symptoms include a change in bowel habits. So if you are experiencing lots of diarrhea or constipation, if you are bleeding from the rectum or have blood in the stool, or have maybe pains, aches, cramps, anything that won't go away, any unexplained or unintentional weight loss, or iron deficiency or anemia, these things can be related to colorectal cancer. So if you have any of these symptoms, we ask that you talk to your healthcare provider. There are things that can increase risk for colorectal cancer, things like your age. If you have things like IBS, inflammatory bowel disease, Crohn's disease, ulcerative colitis, or even a family history of colorectal cancer or polyps, it is really important to get screened. Lifestyle factors like a lack of physical activity, a diet low in fruits and vegetables, or even processed or fiber, So low fruits, vegetables, or fiber is not great. A diet high in fat or processed foods, processed meats, alcohol consumption, and tobacco use can also be risk factors for cancer. And that's all types of cancers. So it's really important to get screened because even having a routine screening schedule, so like annually every 3 years, depending on what type of cancer it is, can detect cancer at an earlier stage. So all of those symptoms we talked about can be potentially prevented if you have cancer screenings on a more routine basis. Prevention is the key. And there are different types of screenings for colorectal cancer. So there's the colonoscopy, which is, I think, the most well-known procedure. It requires a sedation, and that means you're put to sleep, and they put a camera inside of you to look at the inside of your colon and your rectum for those polyps or any type of cancerous mass. You can also get an at-home testing kit, which requires you to collect a sample of your own stool and send it in, and certain tests are performed to look at whether there's blood in the stool or if the DNA in your stool has changed in any way. And then there's also a CT colonography, which is a diagnostic test that can be performed in the hospital setting, where you look at different imaging to see if there are cancer polyps present. People over the age of 45 are recommended to get cancer screened. And like we said before, screening is prevention, so that routine screening schedule set up with your healthcare provider is super important. And the health department actually has a cancer screening program that offers no-cost colorectal cancer screenings for eligible Maryland residents. So we invite you to call 410-996-5168 to find out more information about eligibility for that program.
Because some people think, well, I don't have the money to pay for this or that. I know when I went to my doctor last for my physical, they said, why don't you get your Cologuard? It's a little box they send in the mail, and you like to do yourself, I had polyps, colonoscopy, so you have prompted me to make the call. I've been putting it off. I'm going to do it tomorrow. No, today. And it doesn't hurt getting the colonoscopy. You get, like you said, you get knocked out. You wake up and it's done. And the Cologuard is simple. And if you can prevent something now that is a little problem rather than procrastinate and wait before it becomes a big problem, this is really great. Right?
It is, yes. And the colonoscopy and the colonography, the tests that are done at the hospital or in the office are same day. So it doesn't require large amounts of stays in the hospital. And like you said, the at-home testing kits, the Cologuard, are really convenient. You're in control of your prevention, essentially.
So Jean Marie, a person who may not have the funds to do any of this and, may not even have a regular doctor, they could come to the health department or call 996-5168 and say, I want to sign up for this program. And that would be it, right?
Yep, they would meet with the cancer prevention nurse, Jamie, and she would go through a list of questions to see if they're eligible for the program. But yes.
That sounds like something, especially in Colorectal Cancer Awareness Month, March, that people ought to do. Anything
Definitely.
we missed? Anything we missed, Jean Marie?
No. Please get screened.
Well, thank you for helping us all stay healthy.
Thank you.
And now, ladies and gentlemen, Cecil County in the world. My old friend, despite his youthful looks, he's been around for a while, Randy Schwandt, community health nurse too, going to talk to us about protecting yourself from respiratory illness.
Thank you, Rob, and hi, everyone. Respiratory illness season is considered to run typically from September, October through the month of March into the month of April. There's no clear specific parameters or timeline, but that's the general timeline. And the CDC has identified 5 core strategies to help prevent respiratory illness. 2 most important are probably immunizations and hand hygiene. Crystal's going to talk about hand hygiene, the importance of which cannot be overstated. As far as immunizations, CDC is typically concerned about 3 respiratory viruses, the seasonal flu virus, the COVID-19 virus, and the respiratory syncytial virus, or RSV. CDC recommends anyone 6 months or older being vaccinated for the seasonal flu virus as well as COVID-19. In addition, for anyone who is 65 or over or has immunocompromising conditions, a second COVID shot has been recommended 6 months following the first. So, for instance, we did vaccinate quite a few people in the 65 and up age group in November and December. And I had the pleasure of going out to do homebound vaccines for a number of people in that age group. And at the time, I encouraged them to reach out to the health department later on in the spring if a second shot was something they would be interested in. But will be more proactive and probably reach out to some of the individuals we've already served just to make sure they're aware that that's a possibility. The RSV, or respiratory syncytial virus, typically results in a fairly mild disease. However, for babies and for adults 75 or over, or adults in the 60 to 75 age group with certain medical conditions, asthma, heart disease, COPD, those people are at higher risk for complications and for more severe cases, which would require hospitalization. A more severe case typically results in a type of pneumonia, a lower lobe pneumonia that can be very difficult to treat. So the recommendation is for anyone 75 and over to receive the RSV vaccine, and for someone in the age group of 60 to 74 with immunocompromising medical conditions, which is something they should and could consult with their physician about, to also receive that vaccine. Currently, that is a one-time vaccine. It does not require a second shot. It does not require a series. That does not say that that won't change in the future, but at this time, it's just a one-time vaccine. Now, as for babies, 2 different ways that they can be protected. If mom gets the RSV vaccine during week 32 to 36 of the pregnancy, and the baby is born 14 or more days after that, then the baby is considered to be protected from RSV. The other way is there is a antibody, which we have here at the health department. It's called Beyfortus. So if a child is born during the RSV season, it is recommended that that be administered within the first week of life. Again, we just began to carry that antibody this year because it was identified that there were some needs from certain healthcare facilities in the area. So we plan to have that for the next respiratory illness season as well. And then for a child who is 8 months or younger of age entering the RSV season or that fall season, it's recommended that they also receive that antibody. And again, they could reach out to anyone could reach out to the health department with questions about that. The other parts of the other components of the strategy, I said Crystal's going to talk about hand washing. There's treatment, testing. Now, testing can be helpful in identifying whether someone has a seasonal virus, whether someone has COVID-19. The importance of that is if a physician determines that they would benefit from an antiviral medication, there are specific antiviral medications for each of those viruses. So very helpful to know if you are testing positive for either the seasonal flu or for COVID, and especially if you're someone who could be at risk for complications. The other part is that if you are sick, please stay at home. CDC guidelines now say when you reach a point where your symptoms are continuing to improve and you have been fever-free for 24 hours without the use of medication to maintain being fever-free, then you can return to normal activities, but they also recommend precautions for 5 days, such as wearing a mask when you're going to be around people, distancing, not being unnecessarily close to people, and if necessary, if your doctor feels it necessary, just have a repeat test at some point. But that's, and then the other one to mention is what they refer to as steps for cleaner air. And one of those is harder to do during the respiratory illness season because it's to allow fresh air into your home. And of course, it's most likely going to be cold out. So that's a bit more difficult to do. But two things that could be helpful if you have a central heating, air conditioning system, and if you leave the fan running continuously, the heater won't continuously run, but the fan will continue to circulate air through the filter system, and that's something that they recommend, particularly if you're going to have people over your home, just to have that air circulating for the whole time. And then use of a portable, high-efficiency particulate air cleaner or a HEPA cleaner. I don't know the cost of those, but they are considered to be a recommended item in the home just to keep the air quality where it should be. And the last was to move activities outdoor when possible, but typically that's not going to be until spring. So I'm not sure how easy that's to do in January, December, January. And I think that's it.
Well, thanks, Randy. That's a lot. And I just wanted to add that I got my shot, COVID shot, maybe a couple times through the health department. We went to different places and lined up, and it was very efficiently done. Do you know if they're going to be having more of these type mass clinics or whatever for any of these shots?
I think that's going to be dependent on the need. So we don't have that volume of people coming to us for shots like in the early part. Part of the reason for that I know is that there are a lot of other providers that can administer the COVID vaccine now. There was a time when we were the only party in town that could provide that. But we're willing to do what needs to be done. I believe we have flexibility where that's concerned.
And in fact, my wife and I got ours at the drugstore. Got COVID and flu at the same time, and no ill effects, no side effects, and just my arm hurt for a little bit, and that was it.
Yeah.
Now, an interesting thing you talked about a HEPA cleaner. Somewhere maybe on YouTube or where a guy on TV showed how to take 2 furnace filters and a box fan and some duct tape and make your own for just a few bucks.
Mm-hmm.
Have you heard?
That's
have you
a
seen
great
that?
idea. I may have heard mention of that, but that's a great idea.
I bet it's on YouTube.
Okay.
Anyway, thank you, and I'll be calling you because I want to get some more information from you.
Well, I would love to talk to you, Rob. Thank you.
Thank you. And last but not least, from Cecil County Health Department, this has been a great update so far. I'm doing it on a regular basis. We have Crystal Benton, communicable disease and outbreak nurse, going to talk to us about hand washing, a very important part of safety, right?
Yes, very important. Thank you. Hello, everyone. Today we're going to discuss hand hygiene. Good hand hygiene is a critical component of avoiding germs and staying healthy. Proper hand washing with soap and water is a simple yet healthy alternative, highly effective way to prevent the spread of respiratory illnesses. Cold germs can live on surfaces for up to 1 week, but they lose effectiveness after 24 hours. Cold germs on your hands can live for up to 1 hour. So when you have a respiratory illness, we often have a cough. It's very important to cover your cough. But when you cover your cough, you're coughing into your hand, and then if you go touch a surface, now both your hand and the surface are contaminated. So the goal of hand hygiene is to reduce the spread of germs and prevent infection. Some of the most important times we want to wash our hands are obviously when we're sick, after we've used the bathroom, if we've changed a child's diaper, before we eat, while we're cooking, after we cook, and handling meats and that kind of thing. And as far as how we wash our hands, we want to create friction. That's the most important thing. So you want to get your hands wet on all surfaces, then add soap. We want to scrub back and forth. We want to go over on top of each of our hands. And then, so it's important to remember our nails and the germs that can reside in there. So we're going to clean our nails on both hands as well. We want to do this for at least 20 seconds. A good way to remember this for how long that you're doing it is to sing the happy birthday song 2 times. Once you've gone through it 2 times, you've effectively washed your hands to reduce the spread of germs. If soap and water is not available, you may use an alcohol-based hand sanitizer that needs to be at least 60% of alcohol. Remember, hand hygiene is the single most important method of infection control.
Well, happy birthday to everybody 3 times over. I'll tell you what, that's easy to remember. And, you know, the fact that if you cough and you cough in your hand, you're not spreading germs like that, but then you touch something. That's a lot of people don't think about that. And maybe you should go wash your hands. Well,
Yes,
folks,
sir.
anything else to add, Crystal?
No, I think that's it. Like I said, hand washing is the #1 way to keep yourself healthy and avoid all those germs that are out there.
There you go. Doesn't really cost anything.
No,
And-
just a little bit of soap.
And singing a happy birthday always puts a smile on everybody's face. You can sing it to yourself. You don't have to sing it out loud, right?
Yeah, you could do it in your head.
Okay. Well, thank all 4 of you. Thanks to Health Officer Lauren Levy. And this has been really cool. Monthly update from the Cecil County Health Department. Thank you all for all the work you do. And I used to work for the health department, and I know, in the words of former health officer Dr. Virginia Bailey, a lot of people don't really think about public health, and public health often does its best work when you don't even know it's there. But now we know you're there, and we know some things to do to keep ourselves healthy. Thank you all.